Good evening, dear friends. Well, I was sitting here thinking, what could I please you with? Then I remembered that almost all subscribers have shoulder joints, and we haven't thought about them for a long time, left them without attention. And many of them move poorly, and some even hurt. And today, we will find out how to remove this pain and why it suddenly arises in the first place. Our shoulder joint is formed, as many already know, by the scapula and the humerus. This joint is surrounded by numerous muscles, under which is the joint's connective apparatus and joint capsule. The distinction of this joint from others is that it is more often affected by periarthritis than arthritis. So what is arthritis? Whenever people do tests like X-rays, computed tomography scans, or magnetic resonance imaging, they see the word arthritis and get scared. They fall into despair, stupor, but it's not that scary. Look, there are 3 degrees, 3 stages of arthritis. The first stage of arthritis is here. Sometimes doctors even write degree 0.1, whenever they need to diagnose at least something, So they may put 0.1 and the third stage. Here we have 2 joint surfaces, and let this be the norm. Here we have 2 joint surfaces, 2 joints. Here's one joint surface. Well, let's say this will be some kind of joint. Here's the second joint surface. Here. Normally, a joint has a certain cartilage. It has a certain thickness. And the space here between the cartilages of these 2 bones. All of this is covered by the joint capsule. Everything is located inside here, and there is joint fluid here. That is, the first degree from the norm differs perhaps by a slight thinning there in a few, half a millimeter of the cartilage. But the main difference from the norm is the narrowing of this gap. That is, the difference will be that these 2 joint surfaces here, they will simply be closer. But all the structures are not particularly changed. That is, there are no particular deformations here, and the cartilage is practically the same thickness. The second stage, I won't draw it like that since I don't want to draw the same thing again. Let's just add it right here. So, the second stage. What will the second stage be distinguished by? The joint shell is already narrowing even more, then here changes occur in the cartilage itself. It becomes uneven, and understandably, there is less synovial fluid there as well. Changes in these parts of the bone can occur. Some osteophytes, ossification. This means that in this ligament we see an appearance of, bone. In short, bone tissue. Some osteophytes may grow there. Here. But it will move. This is already the second stage, right? There will be movement, but it will be painful. Now, as for the third stage, the final stage of all this process, it's ankylosis of the joint, deforming arthrosis. Deforming arthrosis, it's when the cartilage has worn out even more. Different bone growths, joint surfaces are uneven like this. Here, and ankylosis, it's when it has completely grown together for us. 2 joint surfaces can grow together. They can partially grow together in some part, or they can grow together completely. To go from this stage to this one, you'll many years to pass, even decades. It's not necessary that every arthritis will end up like this, with some kind of deformations. But unlike arthritis, in the shoulder joint we get periarthritis. What does this mean? This means that there are no changes in the joint itself, not even enough to rate it as stage 0.1. When do they rate it as 0.1, you ask? When a person has some pain. The person claims to have arthritis, so the doctors give in and say, all right, you've got stage 0.1. They dismiss the patient's concerns and send him away. And periarthrosis. Everything is practically perfect there, and all the changes are around the joint. And what do we have around the joint? Soft tissues. What does it include? What hurts? The shoulder hurts, it doesn't lift, but there's no arthritis, no changes at all. Periarthritis flares up. That's why it's called this way in the first place. Mainly, the pain is caused by inflamed tendons or inelastic tendons, which periodically flare up during movement. Or the pain is caused by joint capsule that has lost its elasticity. That is, it's like the ligamentous apparatus of the joint, the same kind of formation. And muscles cause pain as well. The main muscles that cause pain, which ones are they? Depending on where it hurts, you can get some general ideas. For example, pain in the front part of the shoulder. During movement, especially during movement, when a person lifts his hand forward like this, most often this is the tendon of the long head of the biceps that's causing it. So, how can we make it less painful? You don't need to press here, where it hurts, where the tendon itself is attached. The pain is very often right here. Acting on the biceps, specifically this part right here, will alleviate the pain. So, if I have pain right here in this part, in front of the joint, then I need to first try to massage the biceps a little. Our biceps consist of two parts. There is, so to speak, an inner part, as well as an outer part. And what needs to be done? Between these parts of the biceps, between the outer and inner, I need to get in there with my fingers like this. Put them like this and make such a movement. Go up and down like this at first. Along this line. You can feel it. And go to the place where your biceps intersects with the deltoid muscle. Because further on is the lymph node. The inflamed lymph node should not be touched. What do you do next? Again, you put your fingers into this groove, and now you try to separate these two muscles. You make a slight right-left movement. A little to one side to the other side. That is, if there's some sort of adhesions, you remove it. You act on the muscle in such a way that one part of the bicep doesn't interfere with the other one moving. What do you do next? Again, put your hand here and now bend it, then straighten it. Bend it, straighten it. Again, bend, straighten. Hold your fingers on this gap between these two muscles. That's it. Now, you've worked this gap between the muscles. Let's move on to the muscles themselves. Here, you can try doing this with your thumb. Beneath the bicep lies the brachialis, another shoulder muscle. Bicep means a two-headed muscle in Russian, by the way. So, you worked the outer and the inner part of the bicep like this. You can also do it at home, but only those who have chairs at home. These lucky people can do this kind of movement. Like this, sideways. Sit on a chair, put your hand like this, see? What you were doing with your hands just now, do it again. And massage yourself like this. Well, adjust the position of your hand so that your shoulder doesn't hurt while doing this. And this is how you work your biceps. Where the area is more painful, you stay there longer. There. These exercises suit those who have pain in the front. Of course, it can happen that the pain in the front part of the shoulder joint arises from the front deltoid. Then the action right here will bring relief. The deltoid muscle also has several bundles. There is a front, middle, here between the front and middle bundle. This is approximately if you stand like this. Under a 45-degree angle, you can also feel it. You can also feel such a ridge, so you can get into it with your fingers and try to massage it. If it becomes less painful after this, by all means, continue doing it. But don't press on the joint itself. Do it a little lower. That is, don't press on this joint gap like this with your finger. That is, do it a little to the side, further here. Where else do we often feel pain? In the back, in this part of the joint. Let's discuss the most common cause of pain in the middle part of a joint, in order from most to least common. It occurs due to the inflammation of the supraspinatus muscle. The supraspinatus muscle is located above the shoulder blade bone. You probably know what a spine is, but I bet you haven't heard the word spine yet. If you had studied at least 1 or 2 months in a medical college, you had anatomy lessons where you studied bones. And if you got to the shoulder blade, you would have heard such a word there. It's called spine. This is the part of the shoulder blade, see? So, what else is there? There is also the anterior and superior bone of the scapula, right? Anterior superior, anterior posterior. These are located right here. And so we have, therefore, the supraspinatus muscle and the infraspinatus muscle. The supraspinatus muscle is located above the bone, right here. Here it is. The infraspinatus muscle is located right here. Both of these muscles are prone to having such pathological parts, trigger points, which cause very bad pain in the joints themselves. The supraspinatus muscle most often is the cause of the problem. It's where the tendon gets compressed. Where does this happen? Here, see? There is a collarbone, and there is an acromial process here. Here it is. This is the acromial process. Here. There is also a coracoid process. We'll get to it too. The coracoid process, the small chest muscle starts from it. The acromial process, the delta, is attached to it here. And under it, like this, under the acromial process, like this, see? Here. The supraspinatus muscle is located here, and its tendon is located under it. And sometimes this tendon, it starts to get irritated, inflamed, traumatized. And what's another problem? You may also find yourself feeling pain every time you move your shoulder. Because this hump of the shoulder bone should normally slide under the acromial process here like this. And there are cases when the joint capsule has become more rigid. The subscapularis muscle has shortened, the subclavian, subacromial, begins to push this hump directly into the acromial process. And the shoulder goes up like this, and then it rises together with the shoulder blade. Together with the scapula, it begins to move. So, what do I hear? If the subscapularis muscle's tendon is compressed, how do we check it? If there is a very strong pinch, the pain will be like this when you will turn your hand. That is, you have a normal, natural movement. This is what we often do. This movement, this is called supination. And like this, when we turn it outward, this is called pronation. And if you make a straight hand movement like this, it's called supination, got it? But with this, the pain doesn't seem to occur. It occurs when you turn here. That's it. If that's the case for you, then you've got a strong inflammation. If you turn, twist, and start to raise your hand like this and here, under 45 degrees, for example, right? Or forward, but then there will be even more stress on the joint. So you've turned your hand like this, you start to lift it, like with your pinky finger, see? And if pain or discomfort occurs in your shoulder during this, it means there is inflammation of the supraspinatus muscles tendon. What to do in this case? You should not touch it yourself. You should not touch the tendon either. The first thing you need to do is change the position of the scapula. Pinch the tendon when moving the scapula forward. The scapula moves forward with us at different tones, different muscle volumes here and there. To relieve pain quickly, you need to relax here. If you want to make it count, you need to grow muscles here. That is, rhomboid muscles. At least this one, all right? Then you can do the middle and lower trapezius. How to relax here faster under the condition that you can't stretch the small and the large chest muscle and the hand doesn't move up. In that case, you take the ball, put it here, and here you need to work out all these places right under the shoulder blade. Then here, this area. You should definitely do it here and on the small chest muscle, and on the groove between the deltoid muscle and the large chest muscle, and on the large chest muscle itself. That is, you work out this place here. The first one is under the collarbone. The second one is next to the deltoid muscle in the groove. And then all that can also be done. But the main ones are these two places. They'll help remove this pain. After this, your scapula will be a little more free to move back. And you can even do this a little bit, massage here, right under the collarbone with a ball. You can also do this with your hands. If you did this well, you'll notice that the shoulder has gone back a little, and check it. You can do this test freely. Here. So as not to overload our brain with too much information, I'll show the last thing for now. If this is interesting to you, then write in the comments. Let's continue. There is still something else to show. Well, the shoulder joint is like this, so there can be many reasons why it hurts. I'll show you this very good thing. Those who have shoulder pain, it will decrease significantly when acting on the following muscle. This is the subscapular muscle. It is located, as you already know, under the scapula spinae. And in it, there are such painful points when acting on which shoulder pain arises. That is, with a spasm of this muscle, with local tension, the shoulder will also hurt. So, what are we doing here? Take a ball, better even a tennis one, a yellow one, the softer one. Stand up to the wall, put the ball on this muscle area. Here you have your scapula. Right on the scapula here. And here is your task to go through the entire scapula to search where you have painful points. And if you find such a point, when acting on which the pain goes straight into the shoulder, then it means this is what you need. But you don't need to press hard on it. You also don't need to move because the pain will be too unpleasant. Here, I'll demonstrate. Look, you took the ball, placed it here, found the sore point like this, right? A little higher, a little lower. You need to look for this. Whoever has problems with their shoulders, it will definitely be there. Now just stand and wait. The pain might travel forward and you may feel pain here. If it gives off strongly, reduce the pressure or take a smaller ball. And when the pain has slightly decreased, you can press on this area. Do it for maybe even up to 5 minutes. You can already move your hand. Lift your hand like this, but without pain, so that there is no pain in the shoulder joint at this time. Turn it slightly outward, slightly inward. Like this, you can move back and forth, as it includes the supraspinatus muscle more, but there are also round muscles there. Anyway, you see, we've covered a lot of things. Now you need to take a break. And so you've worked everything out, massaged, and you'll also immediately feel relief. Possibly, but possibly not. But if not, no worries. Well, there's only so much you can do. It means that you'll probably find the explanation to your problems in the next video. There's a lot more. There's serratus anterior. There's also a triceps there. Well, in short, trapezius, muscles, the lifting scapula too. All that affects this joint. Yeah, it's complicated. Well, come on. Try to do something. You have a week until the next video. We'll meet here in a week at the same place. Don't forget to update me about how you're doing. So, what can I say? See you next time until new broadcasts. Do sports, help your parents,